Good afternoon. Welcome again. We're actually going to change things up a little bit. I think you've probably all heard more than enough from me over the last couple of weeks. So instead, you're going to hear from the experts and get some operational updates from the various front lines, obviously starting with Dr. Brink, then the Head of Law Enforcement, Rory Hardy, and then Paul Whitfield as Chief Executive of the States. Heidi and I will then briefly follow before we open up to questions, and we will alternate between questions from the media and questions from the public. We've had over 100 questions submitted by email since our call for them in the last couple of days. There are some clear favourites, but we'll perhaps get to that in a minute. So I will just hand over to Dr. Brink to kick off.
So thank you very much. I've sadly just been informed of our second case of COVID death on the island, and our condolences go out to the family at a time that will be very sad for them. So I think that's what I wanted to start off with, some not good news. But looking at our number of patients, we've had an increase of number of cases in the last 24 hours, and I'm going to give a little bit of narrative behind that. So we now have a total of 114 positive cases and 718 negative cases, with 78 people awaiting test results. So that's where we are with regard to that. Now, at the face of it, again, that seems a significant increase in the number of cases. I think what I'd like to make clear at this time is the difference between what we're doing and what other jurisdictions are doing. So we are proactively looking for cases. So we're going out into the community and looking for cases. We have various programs, and I'm going to talk about the one in the long-free surgery, but other areas of screening people, having a low threshold to screen people with respiratory symptoms of any degree, no matter how mild they are. So we've been very proactive. And if I was sitting in front of you reporting in a similar way to what England are reporting, I would be saying to you we have 5 cases of COVID-19, because that's how many people we've had within our hospital. But we've opted, because of our island jurisdiction, because we feel it's the right thing to do for the population of Guernsey and Alderney, the population of Bailiwick, to go out and proactively look for cases. And that's what we've done, hence our increase, or our numbers of cases. Per capita, testing per capita per 100,000, we have a higher rate of testing per capita per 100,000 than our neighbouring jurisdictions. So it just gives some narrative as to why we have 114 cases. I've also tried to take away from the previous times I've spoken to you the questions you've asked me. And I can't remember who asked me. One of you asked me about the demographics of the population last time. And I was about 24 hours out of date when I last spoke to you, but we now have up-to-date demographics of this morning. So the age range of people with COVID-19 in the Bailiwick is from less than 1 year up to well over the 80s. So that's the age range that we're looking at. And the average age for people is 56, with a slightly higher average age for males at 57 and females of 54. So that gives you a good idea of the demographics of the population, and also gives you an idea of the age range of the population. So really important from our point of view. What I do need to talk about today is that we've identified a second cluster within a care home, and we've introduced the appropriate precautions and interventions in that home. We have a total of 11 residents that have tested positive, and two of the care workers, 2 of the staff members. So again, we're looking at how we can help them in these very difficult circumstances. So really important from that perspective. And that work's ongoing. We're doing the contact tracing, and we're linking it all together. So the other thing that I wanted to talk about was the testing, the community testing we're doing in the long-free surgery. So we've now tested just under 40 people within the long-free surgery. We have results back on 15, and 14 of those are negative and only 1's positive. So we're not getting evidence of widespread community seeding on the small numbers that we've looked at in the long-free surgery. I'd like to get that number up to about 100 before I'm confident that we're not looking at these respiratory tract illnesses that are reported in the community aren't reflective of widespread community seeding. I was asked about recovery last time, and I'm sure you're all used to me saying, I want evidence of recovery. Everything of this is evidence-driven. So there are various definitions of recovery. So from point of view, some people will call recovery the absence of a fever for 10 days. For inpatients, some people will call an improving chest X-ray. The most definite, the most definite virological definition of recovery is the absence of virus in the throat and nose swab that we do. And so we've been looking at that as our definition of recovery. And from that perspective, of our people that we've tested, 13 people are now absent of virus on their 14-day swab. So really important. But I think you've also got to contextualize this, is that we are looking at today what happened 2 to 3 weeks ago. So we only clear people on day 14. So really important that there's that lag. So what we also do is when we phone people on their day 14, we ask them how they're feeling. And if they're not feeling well, then we delay their exit testing until they're feeling better. So really important. And that's not the cough. The cough can persist for some weeks afterwards, but if they're still feeling fevery, flu-like symptoms and so on, we'll just delay that testing. So we try and make it bespoke for each individual. So from our perspective, it's again our test, the identification of cases, quarantine, supporting those cases while they're in quarantine, and then looking at a safe exit from quarantine. So our strategy remains the same, and it's remained constant. We're also looking at antibody testing, and we're looking at a variety of antibody testing. I think you asked me about that last time. So with the antibody testing, we've looked at the performance of the antibody assays post-infection. And again, if you look at the performance of the assays, at about day 5, only 20% of people will have antibodies. That rises to about 50% on day 14 and up to 80% on about day 40. So with the antibody testing, we'd want to test a little bit further down the line so we can get a good idea of what is going on in our community. So really important that we use evidence to drive our decision making as to when the appropriate time is to test. We've also been looking at these 96-well plate assays, and we've put in orders for 2 companies. And that will enable us to test rather than on single cassettes, but test 90-odd patients at a time. So a really efficient way of testing, able us to capture that data. So we'll be looking at doing some population-based testing to see what the prevalence of the infection in the community is, but then also looking to perhaps do some more targeted testing for healthcare workers. So those are the 2 strands of the antibody testing we're looking at. And I think those were the main issues that I was asked about last time, together with an update on the most recent cases. So thank you.
Great, thank you. Nikki. Rory.
Thank you, sir. Good afternoon. Law enforcement strategy remains as it has since the first day of this emergency, and that is to support public health in securing social distancing and preventing people transferring the virus. Our work continues to do that, and I would like to thank the public for their support and cooperation that they've given to my staff and how the public have responded to this drastic change in their circumstances. And the feedback I have from my staff is that the bulk of individuals that we've dealt with have really done their best to support that. Our strategy remains to engage, to explain, to encourage, and the enforcement aspect for us is the last resort. So we really are trying to work with the public because essentially people within law enforcement, members of the same community, and we have the same interests. We understand some of the challenges individuals have had, but we also appreciate the way that the public have, in the round, responded to our requests and also have listened to what we've had to say. At the last press conference, domestic abuse came up, and just to really enforce, we are here for people who have domestic abuse situations or are at any point during this emergency placed in fear and they need help. I can confirm that the amount of calls for service in that space have not increased dramatically, but they're pretty consistent with what we would expect under normal times. However, if people need to be reassured, we are there to deal with those types of incidents. I've been asked by colleagues to raise one thing generally in the public domain, and it's really in the space of trying to prevent accidents, particularly on our roads. The first aspect is that the roads are a lot quieter and people generally are driving around the island at greater speeds. I would ask our drivers across the bailiwick to be very careful of their speeds for a number of reasons. One of the reasons is that there are a lot more people out walking or taking exercise, and that when individuals are doing that, sometimes they come across somebody else walking towards them, and we're finding pedestrians are walking out into the road without really checking for traffic. And this is about accident prevention. This is another strand to stopping additional demand on our health service. And some of the feedback we've had is that there's been a few near misses across the island, and we want to prevent any further accidents. So dog walkers, pedestrians, please take extra care, particularly when stepping in the road. And to drivers, please anticipate that some of the behaviours of the pedestrians on the roads won't be as we would ordinarily expect. People do tend to be stepping in the road, trying to give a wide berth. So other than that, from law enforcement, is a big thank you to everyone for the support we're getting, and that's my update.
Great, thank you. Paul.
Good morning. Collectively, we continue to be crucially aware of those of you in the community and in business who need our support now more than ever. Daily, we're adapting our response. The public service is operating very differently today than it was just a few weeks ago, with resources diverted where they are needed most to tackle the issues presented by COVID-19, while we continue to operate the core services that the community needs daily. Many staff working visibly on the front line, many using technology working remotely from home to keep our services running. As of today, 2,362 businesses have registered for support, with over 1,104 applications returned to us so far. We have now begun processing these applications and releasing funds. Payment will be arranged for approximately 100 cases today alone. Processing will continue over the weekend and into next week, and we anticipate approximately 1 week to process the majority of claims from receiving to eventual bank payment where approved. We will add additional resources as needed to ensure the process happens as quickly as possible. Please do get in touch with the business support team if you have not yet registered at gov.gg coronavirus so that we can support you. Calls to the hardship fund continue to come in at a rate of approximately 200 a day. Our backlog from the early effects of lockdown are now on the brink of being cleared, and we are processing these and new claims as quickly as possible, with again additional staff now allocated to this task. Many of you have also kindly asked, how can you assist those suffering financial difficulty and how you might contribute? We hope to make an announcement with details how to donate to both the hardship and social investment funds early next week. Fantastically, more than 4,000 of you have already completed the community monitoring tool online since its launch only this week. That is 6.4% of our population. A great result, and our ability in public services to meet the community's requirements and support the information Dr. Brink and our public health team need to support us in this crisis. As we have mentioned on Wednesday, the information provided is crucial for us to understand what the community need and make sure that that support is prioritised as we redistribute our resources. Of those that have completed the form, though, only 599 are over 65. If you're in that group or have relatives who are in that group and online, then please encourage them to complete the form on www.gov.gg coronavirus, or understandably, if they are not able to do it themselves, please complete this simple form on their behalf so that we can have an accurate picture as much of the community as possible and to get you the support and help you need. We continue to be humbled by the community response to what we are facing together. Whether that be from those going above and beyond to support, working together in every sector, private and public, to the third sector, to those joining the community in the spirit of Guernsey Together. It is this spirit that is driving our response and will drive the earliest recovery. Please continue to engage. Please continue to use gov.gg coronavirus as your source of factual information, and please continue to follow the advice of the experts. Thank you.
Okay, thanks. Paul. Heidi.
Yeah, I'll just be quite brief today. I just want to focus on one aspect, and that's over mental health. We understand for some people staying at home for long periods of time can be boring or frustrating. Lots of other concerns can creep into your head about your job and finances. You may find your mood and feelings being affected. You may feel low, worried, or have problems sleeping. You may also feel isolated and alone, but we're here to support you. There are a number of services and organisations available to help and support you, and there are details of some of this going to be put on the gov.gg/coronavirus page. It's also good to remember that it's okay to feel this way, and everyone reacts differently, but there are people out there to help you. I've just been given the whole list of all the organisations there, both within HSC and the third sector, both locally and more international. And there are people there to support you. You do not have to feel alone. There are people willing and able and want to help you in what are unique, extraordinary times, and that you're not alone. And we must remember this. That's why it's always important to remember it is Guernsey together. Thank you.
Great, thank you. I'm also going to be very brief this morning. I just want to touch on two topics. One of them is Paul's already mentioned in terms of the applications to the hardship fund, and recognising that as household incomes have been squeezed and month-end bills are coming in, many people will be feeling that financial pressure, and so very much in the spirit of Guernsey together, I think now more than ever is a time for us to be talking to each other and working together to try and reach agreement that works for both sides in relation to any money that is owed, any debts that are owed between us. If you owe money and you can afford to pay your bills, then please do so promptly. The person or business to whom you owe money may well actually be under more pressure than you. So don't just make assumptions about anyone else's or any business's capacity to weather this particular storm. And of course, if you owe money and can't afford to pay, then please talk to those to whom you owe money. They may actually be able to offer you some flexibility. So, and if you're owed money, talk to the person who owes you, and so on. And I think talking obviously to your bank about mortgage repayments that are due, talk to your landlord about your rent, but in doing so, do understand that your landlords themselves may themselves be under financial pressure. So it really is a time for us to be talking openly with each other in relation to these issues, and showing as much compassion and flexibility as we can towards each other in obviously what is a very difficult conversation to be had. And then finally, briefly before we go on to talk to deal with some questions, I want to talk about the review of the lockdown rules. It is something which has obviously appeared at these press conferences as a question, and it's a question that obviously we're receiving directly from the public as well. And I'm sure we're going to have some questions on that in a moment. We've had lots of representations made in relation to, for example, allowing garden centres to trade as we head into the spring. And I want to say what I've said before, and it is a commitment that everything is being kept under constant review. We've said it, we've meant it, we are doing it. We all want normality to return as soon as possible for as many people and as many businesses as possible. But please understand that we do need to risk assess any changes, and whether it's garden centres or whether it's solo outdoor trades, we need to balance the mental health and welfare needs of the community and the need to avoid unnecessary damage to our economic base, but whilst ensuring, of course, that there is no compromise to the objective of reducing contact and the spread of COVID-19, of course, in order to avoid any untimely deaths. So without unduly raising any expectations, I can reassure you that we are looking at all of these issues right now on their merits, and it will always be judged in the light, of course, of public health advice. So with that, we will open it up to questions. We'll start with one from the media, and then we'll alternate between the media and members of the public, which will be fed to us. So who'd like to go first? You.
you spoke about support for Guernsey's public, and part of Guernsey's public is the reliance on key workers who might be living in open market properties, who are not currently eligible for help, who might struggle in the months to come with reduced hours at work, paying their bills, paying their rent. What can you say about that?
Well, again, it is a question of talking to, as I've said, really to all of those outlets that are available to them. So the hardship fund that we've talked about, and recognising that there are some constraints around that in relation to those that are still in work, but it's nonetheless is a conversation that should be taking place, together with, as you said, if they're in open market accommodation, with their open market landlords and so on. So I think it's really. As we've said before, of course, we will also continue to keep under review the amount of public expenditure that needs to be committed to this. The scale in extent and length of this was unknown 2 weeks ago. It's still unknown now. It may still be unknown in 2 weeks. So we have to constantly reappraise, bearing in mind the impact on the community, and if we need to adjust, we will. So we're going to go to a question from the public first.
Yeah, so we had a lot of questions through to my coronavirus questions, but some topics clearly of more interest, and perhaps the biggest one is testing. So I think for Dr. Brink, you talked a bit about demographics already, which was a question we had, but how many people have recovered? Is that a figure that we can publish regularly? And then another question off the back of that is, what are we doing about testing of hospital staff, both those who are dealing with coronavirus patients and those who are not?
Okay. So to answer the first question, we've got 13 people that are recovered and virus-free out of the 114 that we've diagnosed with the virus. And we've focused on, again, the evidence for recovery. As I said earlier, there are various definitions of recovery. We've used the virological definition with a repeat test on day 14 to show that the virus has gone. And for the people that we've spoken to, they found that really encouraging to have that call to say, yes, the virus has gone. They found that a very positive moment for them. As I said, that people can have a cough for some time afterwards, this sort of chronic cough. It can go for 2 to 3 weeks afterwards. So we're really looking at all of the symptoms together on day 14 as well. So the clinical recovery. So has their fever gone? Has their tiredness gone? All of those together. So, but the definition of recovery is the absence of virus on day 14. So that was the first question. The second thing is testing of hospital workers. I think I spoke a little bit about the antibody testing when I started, and hospital workers are a group that we would like to do some antibody testing on, but we've also got another program with regard to hospital and care workers that if they have any symptoms whatsoever, we have a very, very low threshold to do a swab of the throat and nose and look for virus. So there are two things that we're doing with hospital workers. The one is trying to ensure that we test any hospital worker with the slightest symptom very promptly. So that's the first arm. The second arm is we'd like to, in probably sort of 3-4 weeks' time, start looking at the antibody response in groups of individuals, including our health and care workers. And that obviously the latter will depend on the availability of the assay. But those are the two arms of testing.
Okay, Heidi.
Yeah, can I just add to that? In terms of testing key workers and who are caring for people, you can't do that all the time. You know, the test is only as good as that moment in time. You wouldn't have enough tests to be able to test everybody throughout the day, throughout the week. So that's why it's the antibody test that's going to be more useful for the future.
That'll show if someone's had the infection and are immune to the infection, certainly in the intermediate term. But I think the other arm is if a hospital worker or a care worker does become slightly unwell, is for them to withdraw from work and for us to rapidly test them as well. So there's the two arms of testing.
Whilst we're talking about testing, it's just worth putting in context because it is such a frequent question. The UK at the moment is testing around about 10,000 a day, which in proportion scaled down to our population size would be the equivalent of about 10 a day. And they're looking to scale up to 100,000 a day by the end of the month, which would again scaled to our population would be about 100 a day. Which of course is where we already are, and when they're talking about 100,000 a day, that includes their assumptions around antibody testing. So it gives you some sense of the scale of testing capacity that we have compared to other jurisdictions. The other thing, you mentioned when you spoke earlier, Nikki, about the different rates of testing. Are you able to put some numbers on that versus the other jurisdictions around us in terms of per 100,000, I think you mentioned?
Yes. So we've just had a brief look at the testing rates per 100,000 population, and our testing rate per 100,000 population is 11.67 per 100,000. And if you look at the UK, it's about 2.46 per 100,000. So that gives an idea of the testing within our jurisdiction. And it has always been our strategy and remains our strategy to go actively looking for cases. And we say it, and we say it every time, is that if we can flatten that curve so that we don't breach our hospital capacity, then I think we will have achieved our aim.
I think it's important there because there's been a lot of misinformation that we've got low levels of testing, and clearly we haven't, and I think it's really important to get that out
It's
here.
the high levels of testing which are producing the high levels of positives because we're
Yes,
finding the cases.
Exactly, yeah.
I think the other thing that one of the issues we're discussing this morning is there is a lot of information about testing which people are seeing in the media and social media. We think that it would be quite useful perhaps next week for us to do some kind of almost sort of maybe a webinar type technical training for us all as a population to understand, because there are different types of test looking for different things, and these are all the things which Dr. Brink and her team are living and breathing daily, and the rest of us having to try and play catch up and understand what an assay means and the different types of equipment and what they're looking for. So I think it would be useful for us all to perhaps grow our knowledge on that area. So that's something we're looking at. And also in relation to PPE, again, a lot of conversation around PPE. What does it mean? What's the different types of PPE? Who should have it? Who shouldn't have it? So we're going to try and put that together perhaps next week. Next question.
A question about the second death. I understand obviously with data protection there are limited things you can say, but can you give us any outline in terms of what demographic they were, what age they were, what any underlying health conditions, were they in any of the 2 care homes that have now got clusters?
I'm not going to comment on individual cases. I feel I owe a duty of care and confidentiality to that person and to that family, but I can't say they were over 80. But that's all the information that I'd give at this time, and I apologise for that, but I do have a duty of care to that person.
Okay, thank you. Next question, public question.
Another very popular topic on my coronavirus questions. We had 13 questions about the virus, how you can catch it, what precautions you can take. So one for Dr. Brink, I think. Can you catch it from surfaces such as paper, cardboard, and do we need to be taking precautions around our post, our food shopping bags? What can those be? And then another question, slightly similar, but if somebody has recovered from the virus, can they be confident that they are not infectious and somebody can catch it from them?
Okay, so we get a lot of questions about how you can catch the virus, and there's basically 2 mechanisms. One is through respiratory secretions, so coughing and sneezing and so on, and the other is through touching or contact with inanimate objects. So the survival of the virus has been looked at on a variety of inanimate objects, from, for example, copper, which is only about 8 hours, up to plastics, which they say is up to 3 days, other objects or other inanimate objects slightly longer. One of the things I always say to people is you've got to consider an inanimate object potentially contaminated, so you wash your hands. And people are focusing on sterilizing everything around them, and then they don't do a simple thing, wash their hands, and they touch their face. So I think going back to the thing, if you're looking at post and so on, is unwrap your post, dispose of the packaging, don't leave it lying around, and wash your hands. Sing happy birthday twice and wash your hands properly. So I think that's really important. So it goes back to your good principles of infection control. And I'm terribly sorry, Rob, but I've forgotten your second question.
The second is about if somebody has recovered from the virus, can they be confident that
Yeah.
somebody else can't catch it from them?
Okay, so that's a question we've been asked quite a lot. And the first thing is to say, this is a new virus? As I've said to you before, it only entered the human race probably in about November last year. So there's a lot we don't know about it. But I, in fact, was asked this a couple of weeks ago by one of my colleagues. And I looked at the modelling of, you probably have heard of the other coronavirus called MERS, Middle East Respiratory Syndrome, which is part of the same group of viruses. And when I looked at that, what you could see is that certainly for the next year or so, the person appeared to be protected. So what I would say is if you've had the virus, if you've had your clearance, in other words, your swabs are then negative, from about day 40 onwards, when you've got the antibodies, we think that you're unlikely to transmit the virus to anyone else. Whether that immunity that you have is long-lasting, I think the jury's still out on there. We just don't know. But certainly, I would think intermediate term, for about a year, there would be some degree of immunity. We also don't know if the virus is going to mutate. So far, it doesn't seem to have changed a huge amount, but there are a number of uncertainties when we answer that question.
Okay, next question.
You've spoken about modelling in the past. Where are we, as far as you're concerned, in relation to other communities in the run of this virus? And have you any idea yet when you might see a peak?
We're certainly behind the UK, but we have had a slightly different strategy in that we've had a very active and very proactive containment phase. So one of the things that we're doing this week, and why I'm doing the broad testing in the long-free surgeries, I'm looking for community seeding of the virus. We haven't seen any of our hospital patients that are admitted with respiratory symptoms come up unexpectedly positive. There are people that are admitted that we suspect COVID on, but with regard to our hospital screening program, we screen all individuals with any respiratory tract symptoms for COVID-19. Together with that, we're testing the long-free surgery. We're going to look at that data together, and that will give us a better idea of community seeding. We know that we've got the 2 clusters and the 2 care homes, and we've been looking at those very carefully. But the question that we want to answer over the next week or so is what the level of our community seeding is. And with our enhanced testing policy, we will be able to hopefully look at that in more detail. So I'm sorry that's not a completely direct answer, but I hope it gives you an explanation as to where we are.
Okay, thank you. Next question, public question.
So another very popular topic, again with about 13 questions coming in, was about garden centres, which Deputy St. Pierre you touched upon, but we had a similar question on hardware stores too. But the question is ultimately, should they be able to deliver? And with that, people have given a lot of benefits they think there might be for therapeutic reasons, mental health, growing your own food. So is that something to consider?
Yeah, well, I'm happy to take that one. It's really difficult. It's a really rubbish time of the year for this to have happened, particularly for people who like gardening, like me. I mean, I find it very therapeutic, and it's a real shame this has happened right now. I think we have to remember where we are. We're currently through the first 2 weeks of this lockdown, so we're wanting to make sure that we have everything down to just exceptional cases, and we've been through all that. We've discussed why over the previous conferences that we've had. I think really we are monitoring it all the time, as Gavin said. We will be, and looking at this when we come up to the anniversary, the 2-week point next week, and we'll be able to say more. But at this present moment in time, we have to follow public health advice to be really locked down as far as we possibly can. And I'd just like to mention about delivery. So when people say, well, surely we can have a delivery, that'll be fine. But in many cases, it's not the deliveries that are the issue. It's the how things are dealt with at that point before they're delivered. So takeaways, the problem with that was not being able to have large enough kitchens that people couldn't socially distance adequately. That was a big risk that we couldn't accept. And the same goes in garden centres, and lots of people wandering around with stuff before it is delivered. Now, as I say, that is where we are now. And really sorry that that's where we are now, but we are constantly monitoring this, and hopefully we'll be able to say more about what our plans are in terms of where lockdown goes next week as we hit next Wednesday when we get to the anniversary, the 2-week anniversary.
Yeah, I mean, everything has to be informed, but as we've said before, so frequently by the evidence. The ability now to have the community testing that Dr. Brink's referred to, but actually building up a sufficiently well-informed evidence base that we can start to use that to inform some of our decision making is clearly key. So that is why we set the initial period of 2 weeks. We absolutely understand the representations that have been made on that issue. And as we've indicated, there is a determination to keep everything under review and to make these difficult judgments based on an assessment of risk, but it has to be informed by our understanding of the public health advice. So there's lots of competing and balancing issues to take into account here, including the mental health and welfare issue, which people have identified with that particular issue.
I think, Nikki, you'll be able to say more about where you are in terms of the information you'll have by next Wednesday, which will help inform us as well.
So I would like to, and please don't hold me to this, but I'd like to have at least 100 results from the long-free surgery testing, which will give us a better idea of the extent of community seeding. And we've always communicated very openly, and I've told you exactly where I'd like to be. Some of the times we've got there, some of the times we haven't, but that's what I'd like to have. I'd like to be able to have that data set to present to Deputy Salisbury and Deputy St Pierre and say this is where we are and this is what we think is happening within the community.
Okay, next question. Sorry, we'll go to the left and then to the right.
Have you identified any more positive cases from the first care home cluster?
No, we haven't. So that remains the same number.
Okay. Sorry, was another question?
Sorry, just to complete that, we haven't. There's a bit of testing outstanding there, but there have been no new ones to date in that cluster. Yeah, but we have some testing still to do there, just to clarify.
Okay.
It's a follow-up to the care home question.
Sure.
Like with the first care home, you tested the whole care home. With this second one, can you confirm that that is the
exactly
case?
the same. Yeah.
And
yeah. So we'll be testing all of the care home residents and all of the care home staff. What's really interesting, I think I said to you last time, is that the presentation can be really atypical in older people, and this is coming out more and more in the literature. So, for example, diarrhea has been quite prominent, just not feeling themselves, slight fever, with the cough seeming to appear later in the cases that we've seen. So what we want to do is to be very proactive early on so that we can then put in what supportive care that person needs. So trying to identify cases early.
And once again emphasising that response is very different to the UK's.
Yes,
To effectively flood that whole environment with testing is not happening elsewhere.
There have been 2 clusters in different care homes. People in residential homes do usually spend quite a lot of time, normally, in communal spaces, in lounges and dining areas. What measures and what interventions that you mentioned earlier have been put in place to limit that contact? Yeah.
So basically, we have a care home cell that is now put up that's actually advising the care home specifically, and we're very privileged that that's been led by Dr. Sue Fleming, who is a very, very experienced person in that field. And so she's looking at all of the parameters, and she's been supported by Karen Leach from Health and Social Care. And they're looking at all of the parameters, all of the interventions, and supporting the care homes with regard to that. So and I think what they're doing is they're doing individual assessments.
Okay. Yeah.
With this new care home, is there enough staff in Guernsey, if we've got 11 at the previous home and 2 at this home, to take them out the system for a couple of weeks to keep staffing of these care homes and of the hospital?
It's really challenging, and you're absolutely right to raise that. What the Health and Social Care has been doing is supporting it with some of their nurses going in, and I think it's a case of all of us working together and working out where the need is. And I think there shouldn't be barriers. It's us sorting this out together. And I think that's one of the things that has been so encouraging, how people have just said, okay, where's the need? And people are moving where the need is. But it obviously is very challenging when you have a significant number of members of staff ill, to actually provide the service we'd like to. So it's challenging, but we're working together on it.
And Paul, I think it'd be useful for you just to describe the measures which are taken to plan for backfilling in a whole range of different roles.
Absolutely. Nikki mentioned before about having a cell in regard to residential home. The terminology cell is basically a specific working group, a team that is put together with lead and specialist relevant staff that actually work on a specific topic. And one of those is a human resource development plan, which is looking at the whole breadth of essential services applied across, particularly across the public sector, and how we can use those resources, how we can repurpose them, how we can redeploy those resources. We've got possibly around about currently today, as we're operating, about 40% of our staff working on visible frontline services. But we're also looking at this key skills, recently retired staff, as to how we can make a pool of staff that we can redistribute and redeploy. We're really conscious that some of our key staff are quite likely to get the virus at some point at a certain degree. And so therefore we've got to be able to supplement. And people have asked me and saying, well, are you using all the staff you've got now and deploying them now? No, we're not, because obviously we're also holding back staff in order that we can deploy and keep them clean, if you like, as and when needed.
I'd just like to add my thanks to the HSC staff who've, they're not precious about it. It's not just about doing the job in HSC. It's been supporting others in the community, including the care homes, and they've gone in there and done the job, and I'd like to thank them very much for that.
Paul, and there's also work, Paul, in terms of those that are currently underemployed in other sectors are also potentially available as well as another part of the resource planning.
Absolutely. There's a multitude of sectors that you can imagine where there's qualified nurses, previous carers are actually being utilised, have come forward. We've got over 100 voluntary staff that are qualified or skilled in one area or another, have said, can you put us on your bank, if you like, and we're looking to see how best we can deploy those staff.
All right, thank you. Next question. And then to the left.
Dr. Brink, you said that the median age is 56 years old, but you also outlined that there was a less than 1 year old, so a baby that has contracted COVID-19. What are is there different symptoms in someone as young as that, in what you're looking for, and how you can sort of see how seriously they've been affected as well?
So we've got 3 under ones, that we've confirmed with COVID-19. Actually, they have done remarkably well. So they've done really, really well. We always worry about any little baby getting an infection, but all of those have done really well. So that's been encouraging.
Okay, and on the left.
My question's for Chief Hardy. The sun's out today. There's a lot of people out and about today. It's been really noticeably quiet over the last 2 weeks that people have followed the lockdown message, but today, for some reason, there's a lot of people out. Do you think you need to reiterate the message to stay at home?
The rules about being out are you socially isolate within your domestic environment. So clearly people do need to or can go out. They can go out for walks, providing they're only with people from the home in which they're living. As long as people adhere to that, we're not getting reports of people breaching what we're asking people to do. People are keeping their distance. Yes, people have to do shopping. We've seen the excellent work that's gone on the supermarkets and the food stores about keeping people socially distant. Some degree of life has to go on to allow people to cope with this, but providing they understand the rules and providing people try and put things in place that keeps people within those rules, I think generally across the island we're not seeing a sort of people going out deliberately to break those rules. So although you may have noticed people out and about, I think we are certainly seeing that people are at certain times of the day more likely to be out. So because they are in isolation, they're staying at home, they are coming out probably more in the middle of the day to do their shopping, have their fresh air and their exercise, and then go back into isolation. So At the moment, we've seen no evidence of that being a deliberate people trying to get round the rules.
And I certainly think that we're heading into a weekend where the forecast is reasonably good. So I think, again, you would expect people to be going out and taking the opportunity with their family to get some fresh air and some sunshine, and that would, of course, be welcomed by public health, that people take that opportunity within their family group. I mean, I think all of us sitting here will have had that anecdotal experience exactly as Rory has described, of being out and about and absolutely finding people are desperate to create space and avoid you. And that is a massive change on a week ago or 10 days ago, where we all feel that we're slightly a bit of a pariah because nobody wants to come anywhere near us. And that's fantastic. That's
Even
exactly...
more than normal.
Yeah, sorry.
Even more than normal.
Thank you. So I think the adhering to the stay-at-home message, and that people do understand why they can come out, but the principle of staying at home is clearly key.
It was just to continue with Mr. Hardy, in terms of officers talking to people and so forth. I believe when this all started, there were stop checks along the lines of the sort of things you do at Christmas for drink driving. Have you continued with those? I mean, or if not, have you any indication of the numbers of people that officers might be talking to? Or are you now, because of what's going on, taking a much more relaxed approach to actually speaking to individuals about why they're out, what their business is and so on?
Certainly not a more relaxed approach. We are definitely out there doing stops, ensuring that people are going about essential business, or they're doing their one shop a week, as we would advise. We are really trying to engage with the public to ensure that people are complying. One of the areas that we need to be very cautious on is that we don't want to be a point of spread, and we need to be very, very careful that our officers are using all the wipes and the sprays and everything that we've issued, because we are having more interaction with the public than most other services. So people will probably notice officers standing off a little bit, maybe a little bit distant, but that's all part of our guidance. And of course, if any of our staff do show any symptoms, they immediately comply with the government guidelines and will not be at work. So that is another aspect of how we're working. What I would just also like to reinforce is I think the ambulance chief went out on social media a couple of days ago, and he was very clear about asking the public to be very open and honest with emergency service workers, particularly if we end up dealing with an incident, whether ambulance or police or any other agency, that please, we would ask the public to be upfront and honest if they have any symptoms or they're feeling unwell. Yeah. If you don't do that, we may not take the precautions that we do need to take if someone has symptoms in their own right. That then leads to frontline workers having to be taken off frontline work because we can't take the risk of frontline workers spreading the virus. So again, it's just an appeal on behalf of all the blue light services, and particularly when you contact Jessic, please be open and transparent about your own personal health, because that allows us to deal with incidents in a way that's proportionate to those individuals.
Yeah, I'd just like to pick up on the shopping aspect. I think I mentioned it 2 or 3 conferences ago. Just about people making sure that they don't just shop for 1 or 2 items. I know that people have been going in just buying a pack of pears or apples and sort of saying, well, no, this is not good use. It increases a risk. So try and do a bigger shop in one go, so you're not constantly going out into a shopping area where, yes, people are trying to social distance, but there is that increased risk with many people in a building at any one time.
And I think there's been an ongoing dialogue with the supermarkets as well, learning best practice from each other, and government has played a role in sort of helping to facilitate that conversation, so that you will see that there have been slightly different practices between the different supermarkets, but I think they are all now moving towards adopting a common standard based on the advice from public health and others. Sorry, next question.
Just, Rory, just back on policing. Jersey, you've told us they've spoken to about 80 people. Are you able to give us any numbers in terms of your officers, how many they've had to speak to in Guernsey? And has anyone been fined?
No, we haven't instigated any proceedings against anybody. We have attended a very, very small number of incidents where, yes, we've had to use coercive powers. They're not under the new emergency legislation, more likely under existing, for an example, an assault or something like that. So we're using more established powers. But no, we haven't enforced any of the emergency legislation. We haven't kept any figures on stops because largely it's community policing, and community policing involves officers talking to the public, but obviously bearing in mind social distancing.
Okay. Any other questions?
I understand, Dr. Brink, we've had some more tests arrive today, testing packs.
Yes.
And can you say something about how many, where, and are they going to just be used across the island, or are they going in a particular place?
No, they'll be used to support our testing strategy. So those are the extraction kits that arrived today, and they'll be used to support the testing in the Longfree, the testing in the hospital, the testing that we pick up through JESIC, the testing of contacts that are symptomatic. So all of our testing, it'll be across the board that we're using it for. Kind of, it's really business as usual for us now. So we
Did you say how many arrived?
so they're in excess of 900 odd. But that we'll divide out over the course of the week.
Any other questions?
I was going to ask you about boating. We've seen a sort of change in the rules to do with people going out on their boats, and that's, as you mentioned, to do with emergency services. But isn't it in the Guernsey DNA to want to get out on your boat and do these things, especially this time of the year when weather's getting a bit nicer and more people would be inclined to go out?
No, absolutely. I mean, there's a whole range of, as I was suggesting earlier, the whole range of outdoor activities that that a number of people have represented to us that perhaps should be permissible. Playing around a golf with a 2-ball rather than a 4-ball. Again, the question of solo tradesmen being able to go about their business. So, absolutely, we understand all of those dynamics, and particularly as we head into the spring and with better weather than we've had a few weeks ago. But I can do no better, I'm afraid, at this stage than repeat everything that we've really said this afternoon, which is we are looking at these issues. We will take a risk-based approach, but it will be informed by the evidence. The really positive news is, as we have indicated over the last week or 10 days or so ago, all of this has to be driven by the test strategy. That test strategy is now being delivered by the on-island facility, and we've got everything we need to allow that to happen. So the evidence base, thankfully, is going to be built now that enables us to develop the exit strategy from this lockdown. So in that sense, we are on track in terms of where we are in this, but we can't make any decisions until we've got that information, unfortunately. I know there's a huge level of pressure and anxiety from different parts of the community that would like us to be able to say exactly, to put a date in the calendar when something is going to change or happen, and I understand that, and it's a challenge to be able to keep pushing back and say, I'm really sorry, but we can't give you that to you today.
I think one of the other interesting things or important things is our pathology services have been nothing short of superb. They have worked so hard to get this going. They have also now trained up, and I think the number was 6 people within the service to provide the testing. So there have been no barriers. It's been, let's look at this, let's see how we can do it. And it's been a real can-do attitude. And I think the island owes them a huge debt of gratitude because they are honestly working as hard as they can. If we ask them to put up a run on a Sunday afternoon, they come in and do it. And it's a massive debt of gratitude that the island owes to that service. So I think that really does need to be acknowledged.
Can I just pick up on what Gavin was just saying in terms of challenge? It's not that we're just blindly listening to public health and going, okay. We are challenging all the time and saying, have we got this right? Are we overdoing it? Are we not? And really, it is that dialogue we had before we even came into this room today with Nikki and say, but can we do this bit here now? And it's not. There is solid reasoning behind the decisions that we are making, and I'd just like to assure the public that it's not just saying, oh right, we'll just follow and just listen to everything. We're not. We're challenging all the time.
Yep.
I have a question in regards to people with long-term medical conditions that aren't necessarily anything to do with the COVID-19 and coronavirus. I've had messages to say that there are reports of people who've started to have difficulties accessing their normal medication, and we already know that non-essential appointments and things at the hospital have been cancelled. I think in the short term, these are manageable, but long term, and we don't know how long this is going to go on for, they're worried that they may be affected. What reassurances can you give people to say that other medical conditions are still going to be treated seriously and cared for?
So my other role is looking after people with certain specified long-term conditions. So that's my clinical role. And I think within that role, and I think a lot of other clinicians are making the same plans. So we're ensuring that people get this, not the same service, but we ensure that they're kept safe over that period of time. And certainly from our patients, I've had numerous messages of support from our patients saying they understand. So, for example, I've been doing some telephone consultations. I can then do them perhaps over the weekend and so on. So I think a lot of us are looking at different ways in which we can deliver services to our patients. I think it is really concerning, and I think it can be concerning for people, and I think it's important that we communicate that. And if people need urgent clinical care, they need to get that urgent clinical care. But actually, we can sometimes look at delivering, for example, a telephone consultation in a safer environment for that individual. So I think people are concerned, and I think I understand that, but I think people are working out how we can deliver these services over the course of this period of time, focusing on what's best for those individuals and what's safest for those individuals. But I think if anyone does have any concerns about it, they should speak to either their GP or, if they're under consultant care, to their consultant. Because that's certainly what we've been doing. We've been having discussions with our patients saying this is how it's going to look for the next few months, and this is how we'll deliver the services. Are you happy with that? So I think those dialogues are ongoing, but I can understand people's concerns.
Okay, one final question. Ewan.
There are some people claiming they might have had symptoms of COVID-19 as far back as last summer. Is that even possible, and does that make them immune?
I think it's unlikely, and I'll tell you why I think it's unlikely. If you think of what happened from into January, centering around Wuhan and Hubei province, is you had the explosion of a new viral infection. Now, I'm aware that some people have said, well, perhaps I had symptoms in summer when I travelled to X place. I think if they had symptoms from COVID-19, from a new virus that hadn't entered the human population, we would have seen a different method of transmission, because there'd be no reason why the epicenter of the epidemic wouldn't have started off elsewhere. So whilst it's not totally impossible, I think it is highly unlikely, just based on our knowledge of how SARS-CoV has spread across the globe.
Okay, we've got time for one more, Daniel.
Thank you. Dr. Brink, you said that our hospital has been divided into clean and COVID sections. If there were to be a positive test in Sark or Alderney, do they have a similar setup over there, or would the patient need to be brought over here?
So the Mini Memorial Hospital in Alderney has a programme of how they would, a strategy of how they would look after COVID-19 positive patients. So they've looked in the Mini Memorial where they would care for people with COVID-19. So they do have a programme there. Sark obviously doesn't have a hospital. And so, again, it would depend on whether the person needed hospitalisation or not. Now, we know that 80% odd, if you look at the literature, can be cared for completely safely within the community. Most of them are mild. Of our 114 cases we've had, 5 have required hospital admission, so it gives you an idea of the level of hospital admission. So in Alderney, the Mini Memorial Hospital would be an option. With Sark, because there isn't a hospital, it would have to be on discussion with the Sark medical officer, with the duty clinicians here.
Great, well, thank you very much. We'll convene again at 1 p.m. on Monday. We've got a whole raft of the questions that were submitted, some of which are quite personal, so we'll see whether those can be responded to individually. Others we may feed into the conferences next week, so we're not going to invite any more be submitted at the moment, but we'll certainly keep that as an option. We'll also continue to try and keep the format of these and the content of these briefings fresh as well, in terms of the sort of relevance of the topics that we want to cover off. So thank you very much, and I hope everybody has a good weekend.